You see the headline, and it's something all of us have been concerned about. Something everybody has been questioning. What are his actual motives? Hmm? And with the Dobbs decision, aka Roe v. Wade, overturned, like we kept trying to tell y'all, it's not so much about abortion rights, it's more about gaining access to your medical records with greater ease and without your permission necessarily. But let's not get ahead of ourselves here. You know how this goes. Let's get into it. Health Secretary Robert F. Kennedy Jr.'s push to collect troves of personal medical data to find the cause of autism has researchers and patient advocates questioning whether his plan to cast a wide net makes it easier to pick and choose information that supports certain theories, including the debunked idea that vaccines cause autism. The bigger picture. The National Institutes of Health has long pushed to include more data collected during healthcare delivery in its research. Kennedy would put a new twist on that by combining federal health data, medical records, insurance claims, and readouts from wearables into what Health and Human Services calls a real world data platform. This just sounds like a hit list of eugenics. The accelerated effort could cut red tape and lead to more effective treatments, or it could turn scientific research into elaborate cherry picking akin to just give us everything and we'll find what we need. It is the latter, okay? There's no way that they're about to cut through red tape because of what they found. They're going to create more red tape for the rest of us and reduce red tape for them in regards of picking us out of society. Because remember, they want an adequate workforce. They want drones in human form. That's it. Gathering huge amounts of data will make it easier to generate phony evidence for RFK's predetermined conclusion that vaccines cause autism, the Autism Self Advocacy Network said in a statement about the research initiative. I believe that because let us not forget the old adage, you will find what you're looking for. And for those that don't understand that saying, when you are determined that something is the way that you believe it is, the more you look, the more your confirmation bias is going to kick in because you're not looking for actual evidence. You're looking to be right. Some health providers are reporting an uptick in requests to remove personal information from patient charts over concerns about privacy and the way the information could be used to support debunked claims. State of play. Kennedy has vowed to find the cause of autism by September. With the help of $50 million in the NIH is investing to link data sets. I don't know how he's going to do that by September when he's cut so much of the research staff, so much of the staff, period, and he didn't know that lupus, Crohn's disease, or many other diseases existed. Is he going back on the heroin so he can concentrate? And no, I'm not being funny. I'm not making fun of addiction. I'm quoting him. NIH Director Jay Bhattacharya last week said they will involve collecting medication records from pharmacy chains, claims from private insurers, lab tests from Veterans Affairs and Indian Health Services patients, and smartwatch data. You know what to do. I don't have to tell you. But after that triggered an outcry in the autism community, HHS on Friday took pains to discount suggestions it was creating a registry of people with autism, saying the result would be a data platform secured by the department and subject to security and patient privacy standards. So yeah, they're creating a database of eugenics listing those that either have an official diagnosis of autism or they suspect could possibly be autistic. And those of y'all that keep saying this is why you won't get your children tested, this is why you won't get a confirmed diagnosis, I think you all are forgetting an important part of HIPAA that most people aren't taught. You can get a copy of that and then you can have it not put into your medical records. That's a part of HIPAA too. Bhattacharya said during a public presentation to NIH advisors last week that the data collection initiative could be used to help develop national disease registries, including one for autism. It's not clear whether people will be able to opt out of having their records included. You can opt out of what's included in your records. Therefore, you can opt out of being included. What they're saying, Kennedy's expedited timeline for the effort and his resistance to the body of evidence disproving a link between vaccines and autism suggested he's looking to use the data to arrive at a specific conclusion, said Paul Offit, director of Vaccine Education Center at Children's Hospital of Philadelphia. That's exactly why RFK either wanted to be president or have this position. He just wants everybody to agree with him because that would cause people to flood his nonprofit with a shit ton of money, and his environmental attorney business would flourish as well because everybody's going to want to sue everybody. I think RFK Jr. has what no science should ever have, which is a non-falsifiable hypothesis, Offit said. HHS did not respond to a request for comment on these concerns. There is already ample evidence that factors like genetics and older parental ages at time of conception increase the likelihood of developing autism. Data is necessary for healthcare research, and there's more research that can be done. But the question is, who's going to do the research if we keep getting rid of highly qualified researchers?